Hi, this is Kendall Peterson in Corpus Christi, Texas. My background, I've studied pharmacology with the University of Pennsylvania Medical School. I'm an advocate member of the American Association of Acupuncture and Oriental Medicine, and today we're going to talk about children's pain management. One of the things I wanted to mention up front, though, is that in our very first class on pharmacology, the professor said that when you ingest an over-the-counter or a prescription medication, the first thing your body does is identify it as a poison. And the way it expels that poison is how we get what we consider the beneficial effects of that medicine. So keep that in mind as we go through this. Children feel and they express pain in different ways. Your child, depending on their age, may or may not be able to tell you that they're in pain. Something that might be painful to one child may not be painful to another one. And the pain may be short-term or it might be chronic and long-term. Your child's care is going to depend on some of these factors. So why is pain control important? Well, if it's not treated, it can decrease your child's appetite. It can affect how well they sleep. It might decrease their energy level and ability to do things. Pain also, it changes their relationships with you. It changes their mood. And if it's treated, they feel better. Their body's able to heal themselves better too as they go along. How do you know if your child is in pain? If they're old enough, they can tell you. If they're not old enough, you may see them restless. They may have high-pitched crying. They're maybe not moving, or they're holding themselves in a position to decrease the pain. They might pull away from you or get upset when they're touched. They may tug or rub or pull or touch some part of the body to make it feel better. They might not be eating, or their appetite may be almost gone. They may not sleep as well as usual. And when we do searches for pain in children, almost exclusively what we get are the results on over-the-counter drugs, OTC drugs, and prescription drugs. And so what you're going to see is you're going to see ibuprofen or acetaminophen come up. You're going to see narcotic analgesics come up. Even PCAs, patient-controlled analgesics, those are the ones where they push the button and they have the pump. But there's also anesthetics that you can inject into the child. That's sort of an extreme there. And when you see the side effects and they say, the side effects of this are rare. Well, if you hear the word rare, that means up to 5% of the people taking it may experience those symptoms. But you see things like nausea, vomiting, constipation, itching, pain in the lower abdomen is really common, irregular heartbeat, seizures, trouble breathing, those sorts of things. Those are all when you just watch any commercial for medication, and you'll see they've almost all got all those types of side effects. How can I help manage my child's pain? Well, first of all, if your doctor has said take pain medication, you probably want to follow the directions of that medication. Don't wait until your child's pain is severe. And one of the things you could do too, if you don't like the medication, if you don't like the side effects, if you don't like what you could be putting in your child's body, is you could try these. This is a brand new technology. This is a Ciara Pure Relief holographic chip. Basically, it gives your child the benefits of acupuncture without the needles, because I hate needles. If you want to know how it works, the guys in the lab have isolated the vibrational characteristics you get from acupuncture, and they've used this to program this chip. Like I said, it's a brand new technology. Bell Labs is exploring this technology. The guys in the lab have isolated the vibrational characteristics you get from acupuncture, and they've programmed this chip to interact with your body the same way. It's a little more complicated than that, but that's an easy way to think about it. Okay, there's no interactions with any kind of medication your child's already taking. Nothing is transdermal, so nothing enters the skin. It's all vibrational, and we have peer-reviewed clinical trials published in a medical journal. The clinical trial for the Pure Relief chip actually had over 500 participants in it. The placebo had an 18 or 20% effective rate. The real chip had more than an 80% effective rate. My family's been using it for 3 years, and we've got phenomenal results with anything we would have been taking. I can't even remember the last time I took a Tylenol or an ibuprofen or any of that stuff. And sorry, Mom, but this chip is actually even better than a booboo kiss. Till next time, we'll see you later. Oh, if you're interested in finding out more, down in the description below this video, there's a link. You can click on that link and it'll take you to more information and how to contact me. Have a great day.